before entering the patient's room, you should prepare all the equipment needed, like the gloves, the pin light, the vaginal speculum. And you should, when entering the room, you should greet the patient. Then you should always provide privacy, and before touching the patient, you should wash your hands, and you should explain the procedure to your patient. Okay, so start. Hello mom, good morning. I'm Irish, your nurse for today. So today I'm gonna perform a health assessment of your genitalia, anus, and your rectum. So is it okay? Before I'm gonna inspect your private part, I'm gonna ask you some question. Okay, so ma'am, when was your last menstruation? Oh, is it regular? The date. Give me the date of your last menstruation. Okay. Oh, how many days? Okay. So age at the time of your first menstruation, first menstrual period. Okay, 12. Okay. Then, are you having a menopause now? Oh, not yet. Okay. Any vaginal discharge? Unusual color, amount, or odor? Okay. Any pain or itching in your genitalia? Any lumps, swelling, or masses in your genital area? When urinating, any difficulty of urinating? Any changes of color? Or problems with sexual performance? Still okay. Okay. Recent change in sexual activity pattern or libido? So still have the libido. Okay. Fertility problems now in the past? Oh, okay. In the past history, previous gynecologic problem? Date of last pelvic exam? Ever diagnosed with sexual transmitted disease or the STD? Okay. Then, past pregnancies? 2020, okay. How old is your baby now? How old is she? Okay, running 4, okay. Previous anal or rectal trauma or surgery? History of blood in stool? Okay, pattern of health screening? Do you have any family history of reproductive or genital cancer? Okay. In your lifestyle, do you smoke? If you don't mind, any number of sexual partners? Okay, only one. Use of contraceptives? You use pills. You try to use pills. Depo. Okay. Any problems with your genitalia affect your functioning? What is your sexual preference? Comfort level communicating with your partners, your sexual likes and dislikes? Fears related to sex? Do you have any stress related to sex? Any fertility concerns? Feelings about going through menopause? So there's a sign, okay? Do you have feelings? Okay. Hormonal changes, you get easily angry, okay? Do you perform monthly genital self-exam? Okay. Tested for HIV? No. Taking estrogen replacement? No. Knowledge of toxic shock syndrome? Knowledge of sexual transmitted disease under prevention? Okay, you know it. Okay. Usual of use of laxatives, stool softeners, or have you experienced enemas? Practice anal sex? Daily water fluid intake? Usual diet? High fiber or saturated fat content? Usual exercise pattern? Walking. Okay, that's good. Any effect on daily life from anal, rectal, or your bowel problems? None. Okay. So now I'm gonna start inspecting and palpating your private part. Is it okay, ma'am? Okay, so that I can have my findings if there's any abnormalities of your genitalia or your anus or rectum. Okay? Inspect the mons pubis. Inspect the labia majora, the perineum. Note for lesions, swelling. Inspect the labia minora, clitoris, urethral meatus, and vaginal opening. Note for lesions, scoriation, swelling, discharges. In palpating, always wear gloves. Okay, start palpating the genital area. Palpate the Bartholin glands if there is any swelling, tenderness, or discharge. Palpate the urethra and observe for any drainage. In internal genitalia, inspect the size of the vaginal opening and the angle of the vagina. Assess the vagina. Insert in the vaginal opening and asking the client to squeeze around your finger, using middle and index finger to separate the labia minora. Ask the client to bear down. Observe for bulging or discharges of urine. Perform the speculum examination. Inspect the cervix for the color, size, position, surface, ooze, discharge, or lesions. Obtain specimen for the pap smear, and if indicated, culture to test for STD. Inspect the vagina, unlocking the speculum and inspecting the vagina as the partially open speculum is slowly rotated and removed. Note color, surface, consistency, and discharges. Perform the Bimanual examination. Palpate the ovaries by sliding your intravaginal fingers to the right. Then observe for note the size, shapes, and the consistency, mobility, and tenderness. Perform the rectovaginal examination. Ask the client to bear down. Insert index finger into the vagina and middle finger into the rectum. While pushing down on the abdominal wall with the other hand, palpate the internal reproductive structures through the anterior rectal wall with attention to the area behind the cervix, in the anus and the perineal area. Inspect for lumps, ulcers, lesions, rashes, redness. Note for the size, shape, the location. Inspect for any swelling or dimpling. Inspect for rectal prolapse with Valsalva maneuver. Palpate for the anal, sphincter tone, tenderness, nodules, or hardness. In rectum, palpate rectal mucosa for tenderness, irregularities, nodules, and hardness. Also palpate peritoneal cavity for tenderness or nodules or rectal shelf. Inspect the feces for blood and perform occult blood tests. If you noted any abnormalities, just inform the physician or make some referrals.